It's the Metro on WDET. I'm Robyn Vincent. Right now, there's a parasite moving through Michigan, and health officials haven't pinpointed the source. It's called cyclosporiasis. It causes what clinicians are bluntly calling explosive, unrelenting diarrhea. The illness can drag on for weeks, and it can keep coming back if it isn't treated. In a normal year, Michigan records roughly 50 of these cases. In the last 2 weeks, it's counted over 570, and it's making people sick from the age of 8 to 84. The parasite usually arrives on fresh produce, berries, herbs, leafy greens. But so far, the source is a mystery. My guest has spent a career on the front lines of that work as a nurse and as the person now responsible for protecting one of Michigan's largest counties. Kate Guzman is the Oakland County Health Officer. Kate, welcome back.
Thank you, Robyn.
Let's start simple, if we could, because a lot of people are hearing this word for the first time, cyclosporiasis. What is it, and what does it actually do to someone who has it?
Yeah, cyclospora is a parasite, and we don't typically talk about it very much because we don't see very many cases. We looked at our average over the past 5 years, and we'll see anywhere from 3 to 15 cases a year in Oakland County. So for a county of almost 1.3 million people, it's not really impacting our community. So I don't blame the public. It wasn't on my radar, really, until about 2 weeks ago. And so this has been a steep learning curve for many of us that are not parasitologists. But cyclospora is a parasite that is a really tricky parasite. What I've learned is that it's hardy, it's resilient, it's resistant to death by the usual means. And it's also sticky. And that's a point that I want to highlight for the listeners. It's a sticky parasite. And that's why it gets into raspberries and it gets into the leafy greens and it sticks there.
I just have to jump in and say these are all the words I do not want to hear describing a parasite that can make me sick. That it's hardy, that it's resilient, that it's sticky. Go on, Kate.
Cyclospora is different than our typical food-borne illness parasite. Like we talk about cryptosporiasis pretty regularly, cryptosporidium, I'm sorry. And crypto is a parasite that is actively spread person to person. So crypto is one of those nasty parasites where, if someone doesn't wash their hands and then they're preparing your food, you're going to get sick pretty quickly. And cyclospora is very different because it doesn't spread from human to human in that way. It's actually not infectious when it leaves a human body in stool. It has to live in the perfect environment and the right temperature to become infectious. And it takes about 1 to 2 weeks. And so it's not spread in that typical fashion where we picture someone working at a restaurant that hasn't washed their hands and then has prepared your food. We're really talking about broader infrastructural challenges when we're looking at cyclospora, where we're talking about wastewater, we're talking about human feces that have infected, say, washing water, irrigation water, broader level infection sources. This is why it's so tricky to track.
So it's not just about pinpointing potential produce. It is about multiple systems interacting at once.
Yes, this is what makes it so complex. And so on a local public health front, I have lots of teams, right? I have a team of epidemiologists and communicable health nurses and environmental health food investigators. And typically when we receive foodborne illness complaints, we'll see 2 coming from 2 different households in the same restaurant. We send out food inspectors. They go out and they talk to the restaurant owner and they watch their sanitation practices, and they can kind of quickly say this is where the problem is. Let's either shut this restaurant down, get it fixed up, get them reopened, and nobody else gets sick. This is not at all the case right now.
Okay, so you've got county investigators, you've got the state health department, you've got the state's agricultural side, then you have the CDC, you have the FDA above all of them. I do want to look at that coordination and how it may be changing. But before we do that, I want to stay right here in Michigan. I'm thinking about Michigan's chief medical executive, Dr. Natasha Bagdasarian. She recently spoke about the outbreak with WDIV.
This is definitely not something that we see normally. We normally get about 50 cases of this particular illness, cyclospora, over an entire year. So this is a very unusual trend, and we are continuing to see more cases.
Okay, here's what struck me about the doctor speaking just now. When she uses a word like unusual, what is she signaling to people like you who have to respond to this, Kate Guzman?
Yeah, actually, thank you to the Michigan Department of Health and Human Services and Dr. Natasha Bagdasarian for giving local health department a heads up as soon as they knew that this was a cyclospora issue. And so we had a heads up about 2 weeks ago, right at the very start of this. We had a heads up to be on the lookout. And so when the state is flagging something as unusual, it's telling the local health departments, be on the lookout. And so what we would normally see, like I mentioned, maybe 7 cases a year of cyclospora, and it typically doesn't make people very ill. It's typically not fatal. We don't see a lot of hospitalization, so it doesn't rise to the top of our priorities when we see a single case. But having that heads up that we're seeing unusual activity makes us aware that when we see one single case of cyclospora, we need to really hone in on it and do that case investigation as soon as possible so we can contribute to the statewide investigation that's happening. In Oakland County, we have 32 confirmed cases, which is just a drop in the bucket of the overall state number of cases that we're seeing.
Right, which just several days ago, it was, I want to say, around 300. And then on the 4th of July, that was when the state issued updated numbers showing that we are at 572. I want to think about what's happening at the federal level right now and how it connects to all of this. Last July, the U.S. Centers for Disease Control and Prevention scaled back a program that's called FoodNet. Mm-hmm. It stopped requiring states to report 6 foodborne germs. And the parasite causing this illness, cyclospora, is one of them. Mm-hmm. What did FoodNet do?
FoodNet was a way, well, it is a way to, it's a surveillance technique. So it utilizes 10 states. There's 10 states that are enrolled in FoodNet, and they're really monitoring these 8, well, now scaled down to 2 foodborne illnesses. And they're looking at really the DNA footprint or fingerprint of the illnesses to try to connect them. And so by connecting them, it contributes to the overall traceability where we can trace back to the source and get to the root of the problem faster. And so there were 6 pathogens cut from FoodNet. And while we don't see the impact of that on a local level directly, it definitely impacts the overall landscape of how food safety is handled on a national level.
Okay, so Michigan wasn't a part of FoodNet. No. But experts have said FoodNet was the only federal system actively looking for several of the pathogens that you noted at once. The others wait for states to report upward. So I guess what this has me wondering, Kate, is when you weaken the thing that's actively watching, does an outbreak like this get bigger before anyone notices?
Yes, and that is the real issue. That's why surveillance is so important, Robyn. When I think about a program like FoodNet, hearing that it's cut, it hurts all of us without most of us even realizing that it's happening. It's protecting us on such a broader level. And so we think about surveillance. FoodNet is one piece of it, but there's also another form of surveillance, wastewater monitoring, wastewater testing. Currently, that's not set up to test for cyclospora, but that's another way that on a national level, we could implement wastewater testing for a parasite such as cyclospora and see that it's happening. We can actively monitor the wastewater of residents, see that there's a spike, and that's when we can engage our local providers and say, we're seeing a spike in cyclospora. be on the lookout. This should be part of your differential diagnostic testing. So when someone comes in or they're calling your office and they have these symptoms, these GI symptoms, make sure you're testing them for cyclospora. Because if we're not testing people, we can't get to the root of this problem. If we're not testing people, the lab results aren't coming through to our state system, our epidemiologists aren't alerted to do or the case investigations, we're not doing the tracing that needs to happen. We'll never get to the source of the problem.
So in other words, when you're trying to figure out if Michigan's cases connect to cases in other states, the removal or the diminishment of FoodNet is affecting the federal view that you have. It's affecting your ability to make some stronger connections about outbreaks, about the way that diseases are moving.
Yes, and that's so important, just thinking about how interconnected we all are. And so if it really is a contaminated irrigation system for a produce distributor based out of another country even, that produce is being distributed across the nation. It's not only being distributed to Michigan, right, or to Oakland County, to Monroe County. It's being distributed broadly. It's so important that we stay connected. And spikes in other states are indicators of spikes that we may see next.
You're listening to The Metro on WDET. I'm Robyn Vincent. My guest is Kate Guzman, the Oakland County Health Officer. We're talking about a parasitic outbreak in Michigan called cyclosporiasis with over 570 cases in the last 2 weeks. Health officials haven't found the source yet. We're discussing what it takes to hunt one down at a moment when the federal government is scaling back some of the safeguards built to spot outbreaks. Now, let me give you the federal government's side directly, Kate, because it has made a real argument. It's said that it's narrowed FoodNet to focus on the deadliest pathogens, Salmonella and E. coli, and that other surveillance systems will still cover the rest. What do you make of that explanation?
I hear that, and I hear almost verbatim words that have come out of my mouth when I've been faced with funding cuts or staffing shortages. And as a public health leader, I have said multiple times we need to focus on what is impacting the community the most. So we're looking at what is the most virulent, what is the most harmful, what is potentially the most deadly, and we focus our efforts there first. So something like cyclospora, which doesn't have a high fatality rate, falls to the bottom when you're prioritizing in public health. But when we say it has a low fatality rate, that's because it's not widespread, right? So when you only have 7 cases a year in a county, of course it's going to have a low fatality rate. It's just not hitting as many people. But when it's widespread and it's impacting a broader community, it's hitting elderly, it's hitting immune compromised, it's hitting people on chemotherapy and other immune compromising treatments. And those are the people that will truly get sick and suffer from something like cyclospora, or some, normal healthy individual is going to be uncomfortable and have some acute symptoms for a while and then recover. So when we have more cyclospora in the community, more cyclospora produce being distributed broadly, more individuals are at risk of exposure and therefore severe consequences.
Kate, what you're telling me is that public health sometimes is a matter of picking and choosing your battles, having to set priorities. I'm wondering, though, do we have the resources where we can make most things priorities? I mean, we're talking about living in the richest country in the world. We're talking about, you are overseeing a county with great wealth. Do we have the resources? Is it a question of will and something that we're seeing at the very top in terms of what the federal government is signaling as priorities?
No, it's an amazing question, Robyn, because do we have the funding? Do we have the capacity? Sure. Is it currently available? Not always. And so we really learned that during the pandemic when the government decides to put funding and focus on a public health priority such as COVID-19, it made everything more efficient. It made our response more effective because we had extra funding, extra staffing, and we had the capacity to truly focus in on COVID-19. And that was a great lesson in what some focused, prioritized funding toward public health can really accomplish.
I want to get concrete about the hunt itself because it is fascinating, but also it's concerning. I mean, finding the source of something like this takes a lot of people, as you have noted. Again, we're talking about county investigators. We're talking about the state health department, the state's agriculture side, then the CDC and the FDA above everyone. But what I'm hearing from you too, though, is that the coordination is only going to work if every link is staffed and funded. From where you sit, is that chain as strong as it was a few years ago, or are there weaker links now?
It's a tough comparison, Robyn, because we're not in a pandemic. So it's a little tricky to compare current times to, 4 years ago. I will say we had more staffing and more funding during the pandemic to really focus in. But where we're at now is where we were pre-pandemic. So Oakland County Communicable Disease Team hasn't taken any hits post-pandemic compared to where we were pre-pandemic. What it does to our team when something like this comes up is it takes us away from responding to the 17 other cases that have come in on a Monday morning, right? And so all 4 communicable disease nurses and all 3 EPIs this morning will be focused on cyclospora. And so as other pathogens are coming in, someone on the front end, our clerical team is looking at them to see if they need to be red flagged. Otherwise, they're getting tucked into a queue that grows longer and longer while we're handling cyclospora. So each investigation will be so detailed and lengthy because of the incubation period of cyclospora. This is another issue. It can be from 2 days to 2 weeks when someone gets sick from the date of exposure. So in a typical foodborne illness, our window is really short. Someone eats something and within 72 hours, they're sick. So we look at their food history over the past, say, 3 days. In this case, we'll be looking at someone's food history over the course of 2 weeks. And when I'm talking about food history, it's not just, hey, Robyn, where did you eat and what did you eat? I actually need to know, Robyn, when you bought that bagged salad at Kroger on July 1st, what was the brand? Can we find the lot number? Right? And so it is every single thing. Was there a cucumber? Were there carrots? What did you put in that salad? Where did you eat this? Oh, you ate at a family party and you had a salad there. We'll never be able to trace that back. Right? It's so tricky.
And so right now you're role playing in being one of your county investigators. So you're talking to me, let's say, and I am not the Robyn who trusts public health quite a bit.
Exactly.
I'm a skeptical Robyn. I am really not picking up what you're laying down. Okay, so I want to think about this because there's something even bigger underneath all of this, and it's something I realize you're focused on, and that's building trust with residents. And public health only works if people pick up the phone when your investigator calls or go get tested when they feel sick. And so me playing the role of the skeptical Robyn here, I mean, does that make an outbreak like this harder to solve when I say to you, hey, county investigator, I'm not going to spend too much time trying to answer your questions because I don't trust you?
Yeah, it's a real issue. We are building our relationships with the providers in our community more and more because we know that the community trusts their healthcare provider more than they trust public health at this point. And so when someone goes to their provider, they have these GI symptoms, they're tested for cyclospora, and then have the call from their provider that says, guess what, you tested positive. This is what we're asking providers to do. The next statement is, you will be contacted by the local public health department. This is an important part of a broader public health investigation. Please give them as much information as you can recall.
And by provider, you're meaning like when you go to see your primary care physician.
Yes, or even an urgent care. I think a lot of urgent cares were probably hit over the weekend with people feeling ill. And the case numbers that jumped so rapidly are actually a great sign to me, to be honest, that the word is getting out and that the community is putting a little more trust in us. Because many people with diarrhea, bloating, nausea don't seek care because it is self-limiting and it does go away. But because this has hit the media, news is getting out there. Please get tested. Please get treatment. There is, easy treatment available. I feel comfortable that the word is getting out there. That's why our case number has jumped so greatly over the weekend.
I need to ask you the most crucial question before I let you go, Kate, in the last 30 seconds we have here. For the family that's listening, it's in the middle of produce season. What should they actually do? What are you personally watching for over the next couple of weeks?
I am asking everyone to wash your produce. It's not a fail-safe method to get rid of cyclospora parasites, but you have to give some aggression. You have to physically remove it. Like I said, it's sticky. So running water and using a produce brush and agitating your produce is your best technique. But honestly, cooking all your vegetables, peeling them, being very thoughtful about what you're eating out at restaurants and picnics and when you're out and about.
Kate Guzman is the Oakland County Health Officer. Kate, as always, thank you for your vital info.
Thank you.
It's the Metro on WDET. Coming up, dozens of localities in Michigan have passed moratoriums to prevent data centers from entering their communities. Our next guest says that may not be a good idea. Why? We'll hear about it next. Stay with us.